So, are you an international medical graduate or a physician trained outside Canada and you're wondering how to start working as a doctor here? You know what? You're not alone and you are not without a roadmap. By the way, my name is Dr. Nana Yao Amubruni. That's the long way to call my name, but most of my students and doctors call me Dr. Bruni. And I'm a practicing physician in Canada and the lead tutor at MedCognito, where we prepare doctors like you to navigate the Canadian medical system confidently. And in this video, I'm going to give you a clear step-by-step breakdown of the entire process to become a licensed doctor in Canada, even if you have to start from the scratch, okay? Canada does not have one national licensing system. Rather, each province or territory sets its own rules through what we call the MRA. You may be asking, what is MRA? MRA is the Medical Regulatory Authority. So keep that in mind, okay? But almost all the MRAs follow a core foundation, which is called the Canadian Standard, which was created by the Medical Council of Canada, which is also known as the MCC. To qualify for full unrestricted medical license in Canada, the Canadian Standard requires that you meet 4 things. Number 1, you must have a recognized medical degree from a school in the World Directory of Medical Schools, and it must include Canada-sponsored notes, okay? Number 2, you must have the licentiate of the Medical Council of Canada, or what you call the LMCC. And number 3, completion of an approved postgraduate training program in medicine from the jurisdiction you're coming from. And number 4, you will need certification by either the CFPC, the RCPSC, or the CMQ. And you may say, hey, whoa, what are these abbreviations? CFPC, RCPSC, and CMQ. So the CFPC stands for College of Family Physicians of Canada. And the RCFP SC stands for the Royal College of Physicians and Surgeons of Canada. And the CMQ stands for Collège des Médecins de Quebec. That is for Quebec only. That is the French-speaking province in Canada. Okay. So now, let's walk through the typical steps of an internationally medical trained or international medical graduate into Canada. First, one of the things you need is to get your language tests. Okay. So you are required to get a language test if your degree in medicine was not taught in English or in French. And for a lot of countries, even if it was taught in English, you still have to write the English test. And the options can be IELTS, that is the International English Language Testing System, okay? Or the OET, which is Occupational English Test, or CELPIP, which is Canadian English Language Proficiency Index Program. What I will say is that take your time, look at what is accepted in the province or the territory you want to practice in, and take that. Okay, don't just assume and go take one particular exam or the other. Just go back. So whichever province you want to practice in, whether it's Ontario, BC, Alberta, New Brunswick, Manitoba, just go back and ask yourself, do they want IELTS? Do they want OET? Do they want CELPIP? Whichever one they want, take that and go ace it. The second thing I want you to do then is to create a physicianapply.ca account. Okay, physicianapply.ca account. So it's spelled as PHYSICIANSAPPLY.ca. This is the online portal for applying for Canadian exam, where your documents and credentials will also be verified, and where you submit your documents for the various licensing authorities. And the physiciansapply.ca account is run by the MCC, which is the Medical Council of Canada. All right. Then step 3, is you need to source verify your medical credentials. When you source verify your medical credentials, this confirms your medical school degree is valid. Okay. So what happens is that, for example, let me give you the snapshot of what happens. So you've attended medical school. For example, I attended medical school in Ghana. I already have my transcript, right? It is loaded into my physiciansapply.ca dashboard. Now, I give a request to the medical council, the physician apply to send that transcript, a copy of it, back to the medical school I attended. And then the authorities in the medical school will put a stamp on it and sign and indicate that, yes, this person was in the medical school from this year to that year, he graduated, this transcript he's presenting is valid, right? And then it is sent back to the physicianapply.ca or the Medical Council of Canada. Then they upload the source verified document into your portal, which means that they have been able to verify that that document you submitted is true. Next step, after you've gone through the first 3 steps, is to pass the MCCQE1 exam. MCCQE1 stands for the Medical Council of Canada Qualification Exam. Okay, and the part 1 exam is a computer-based exam. So previously it had 2 parts, which had MCQs and what we call clinical decision making. But from April 2025, so whenever you're watching this video, from April 2025, the exam is now only MCQs. All right, and it is at the level of a Canadian medical student who is in the final year. Okay, and this exam covers so many things, and I'll just highlight some of them: ethics, how to make diagnosis, how to manage patients, professional behaviors, those kinds of things. After you've taken your MCQE1 exam, if you want to be very competitive across many provinces, I will suggest that go ahead and do your NAC-OSCE exam. What is the NAC-OSCE exam? The NAC-OSCE exam is an OSCE exam, an oral exam. So unlike a computer-based exam like the MCQE1, the NAC-OSCE exam is more of, you talk to patients, examine them, manage them, and these are what we call SPs, right? So they are standard patients. So they are not actual patients with the medical condition, all right? It's a hands-on, objective, structured exam. And you need the NAC-OSCE for your CARMS application. And I'll be coming to these words, CARMS and all these things in future videos. But CARMS is basically the Canadian Residency Merchant Service, okay? And some provinces also need the NAC-OSCE for what we call practice-ready assessment. The practice-ready assessment basically is you coming in, not going through residency in Canada, might have gone through residency in your home country or might have been a general practitioner, and you go like, I can practice at the Canadian standard. You come in, the various territories or provinces pick you, they put you under the supervision of some doctors, they look at how you practice and compare to the Canadian standard, and they'll say, okay, check mark, this doctor qualifies to practice medicine in Canada. All right. So we have CARMS and we have practice-ready assessment. So at this point, you will have to choose one of 3 major pathways. You either want to choose the CARMS pathway, the second pathway is a practice-ready assessment pathway, or the third pathway is what we call the International Residency Recognition pathway. Now, let me take my time and go through the CARMS pathway quickly. So, as I said, CARMS stands for the Canadian Resident Merchant Service. And it is best for IMGs who haven't done residency yet, or some IMGs have already done residency, they were specialists, but they are willing to start fresh from the residency level and get into the system, okay? And you must complete a Canadian residency to be eligible for full licensure if you go through the CARMS march. So that is where, you become a resident, you go through the training from a particular Canadian medical school or university, for your residency program. And then, depending on the length of your residency, for example, if you're doing a family medicine residency program, it's 2 years as at 2025. Some people, after doing their family medicine, may do what we call an added +1, say in emergency medicine, okay, or in other disciplines, other different specialties, say pediatrics, psychiatry, emergency medicine itself, radiation, oncology, or public health and preventive medicine. Each of these have the number of years you need to use to go through. Then we also have what we call the practice-ready assessment, which is commonly known as the PRA. Now, for IMGs who already completed residency abroad, you undergo a 12-week workplace-based clinical assessment. And you can do this in various provinces like British Columbia, Saskatchewan, and in Saskatchewan it's called SIPA, Manitoba, Newfoundland, New Brunswick, Prince Edward Island. Many of the provinces offer the PRA program. So you can look into that. Then the third pathway is also what we call the International Residency Recognition Pathway, which is for physicians with accredited postgraduate training abroad. Okay. And for those with accredited postgraduate training abroad, all you need to do is to apply to the CFPC, which is for family medicine, the RCPSC, remember when we talked about that particular acronym, which is for various people from various provinces, from various specialties, or the CMQ for those who want to go and practice specifically in Quebec. Okay, so once you've completed your exam and your chosen pathway, here are your final licensing steps. Apply for your LMCC, which is your Licentiate of Medical Council of Canada. Apply for your specialty certification from the CFPC or the RCPSC or the CMQ. Apply for medical registration from your chosen medical regulatory authority. The truth is, most medical regulatory authorities accept direct submission through your physician's apply account. That is why it is good to make sure that the first thing is to get your physician apply account right from the word go. Okay, so examples of some of the medical regulatory authorities are the College of Physicians and Surgeons of Alberta, which we call CPSA. So if you just Google that CPSA, it will take you to the College of Physicians and Surgeons of Alberta. We also have the CPSBC, which is the Medical Regulatory Authority of British Columbia. We have the CPSO, which is the College of Physicians and Surgeons of Ontario, and others, which are all across Canada. What you have to understand is that each province may have additional requirements like return of service, supervision, or language exams. And that's why MedCognito teaches you how to evaluate which province fits you best. All right. Now, so let's recap the full IMG roadmap to becoming a doctor in Canada. First, think about the language proficiency you're going to take based on the province or the territory you'll be practicing in, whether you're taking IELTS, OET, or CELPIP. Number 2, create your physiciansapply.ca account. Number 3, verify your credentials through the Medical Council of Canada source verification portal. Number 4, pass your MCQA1. Number 5, take your NACOSKI if it is needed. Number 6, choose your path. And some doctors can choose more than one path. So they can apply for CAMS, they can also apply for PRA or even the international certification. So that if this does not work, this works. And at times they can also get all three and then they can decide, what do I want to do? Okay, then apply for your LMCC, then apply for your certification from the CFPC, the RCPSC, or the CMQ for Quebec, and then apply for your provincial license through your medical regulatory authority. So, are you already trained in a particular discipline? Then maybe practice ready assessment may be your fastest route. Do you want to do family medicine? Then you may want to look at the CFPC direct route if you've already had the training. If you prefer Quebec and you know how to speak French, I don't know how to speak French, but if you know how to speak French, then CMQ has its own path. So becoming a doctor in Canada isn't easy, but with the right steps, it's absolutely possible. I've helped hundreds of IMGs navigate this exact process, and in the rest of the series, I'll guide you through each step in depth. So what I need you to do is this: subscribe and turn on notifications so you don't miss how to pass the MCQA1, practice ready assessment breakdowns by province, the truth about return of service. And I will also put a link to our MCCQA1 objective handout for you. It's going to be in the description below. Okay, just click on it, download it. And by the way, I want us to engage in a conversation. So ask me your biggest questions in the comments below. I'll read every one of them and make sure that I answer them. As usual, this is your friend, your guide, your mentor as you try to navigate this Canadian medical system. Let's keep talking, let's keep chatting, and let's ace all the exams as well as get into the Canadian medical system. See you on the other side.